Good morning. In today's lecture, we'll be covering several other clinical examinations. So first, we will be covering squint examination. So in squint examination, firstly, you will simply inspect the patient for any visible deformity. If there is strabismus, which means that there is misalignment in the eyes of a person. Now, there are two types of squint, manifest squint and latent squint. Manifest squint is that type of squint in the eye in which the eyes are physically misaligned with each other, whereas latent squint is that type of squint in which the eyes are not visibly misaligned with each other. However, we can know which the type of squint by the cover and cover test. So once we get started, we will first do the Hirschberg test, which means that we will shine a torch and on the nose, and simultaneously there will be pupil reflex. So now we need to see that the pupil reflex is at the exact center of the pupil eyes. If it is towards the nose, it means it's esotropia, and if it's towards the temporal side, it means it's exotropia. Now we come to the cover and cover test. The cover and cover test means that we basically cover or occlude one eye and then see if the uncovered eye has any movement in it. If the uncovered eye has any movement, it means that it is trying to fixate towards the target and thus is showing basically manifest squinting. Now, in the uncover test, what we do is that we simultaneously uncover the same eye which had been previously occluded and then see that if there is any difference. For example, if the eye has basically aligned towards specific direction in order to fixate towards the target. And the third test is uncover test, which is used to basically recognize latent squint, in which simultaneously rapidly the two eyes are occluded one after another. And the other tests include the prism cover test. Also, we will be doing the extraocular movement test, in which we will be giving the command to the patient to keep his head still and not to move his eyes. Then we will be select a specific pen or a specific thing and tell him to move his eyes to follow the pen. And we will note for any restriction or of the eyes movement. So this covers mainly the process of squint examination. Now we'll be doing the pupil examination. In order to detect pupil examination, we will shine a light at the two eyes, and then we will see that if the pupils are central in shape, they're equally reactive and they don't have any irregular position. So this covers the pupil examination. Now in the pupil examination, you need to also know that whenever you shine light on a person's eyes, there is a direct reflex and an indirect reflex. In the direct reflex, the eyes will be shrunken. However, in the indirect reflex shows that the contralateral eye also shrinks because this is because of the eye afferent pathway, because there is a optic nerve pathway, or the optic nerve relays the message to the optic chiasm, which relays the message to the optic tract and vice versa. Now I will be covering the ptosis examination. So in the ptosis, this was all the squint examination. Now in the ptosis examination, once again, we will be taking the general history of the patient, whether the ptosis was sudden or was it general, the associated symptoms, whether there was any variability in ptosis, followed by we will be taking several other measurements, which include the marginal reflex distance, the palpebral fissure height, as well as the basically pre-tarsal show. These are all the measurements which will be taken by a scale. After that, we'll be testing the levator function. We will place a finger on top of the frontalis muscle and then measure the height with the help of a ruler. So the normal levator function is 12 to 15 millimeter, and its significance is that if in case of reduced levator function, we use the levator sling operation. Now, lastly, we'll be doing the pupil examination, but I've already covered it in great detail. And also in the ptosis examination, we'll be doing the extraocular movement once again. Now, lastly, I will be coming to the proptosis examination. In proptosis examination, you have to find out if the person suffers from Graves' disease or thyroid disease in the past. Now, an extremely important question is to ask the person if he is facing diplopia or double vision. This comes under the heading of visual acuity. Whenever you test the visual acuity, you also have to check the color, contrast, and diplopia of the person. Now, after taking this, you have to see if the eyes are visibly protruded. You have to go towards the back of the patient and generally see the overall facial symmetry. You can see the post-oral lymph nodes. You can palpate them. to see if there is any viral infection. For then you can see using the Hertz exophthalmometer to see if the eyes are visibly protruded. However, if you don't have this device, then using a simple scale, you need to measure the length of the eyes, and if they're greater than 20 millimeters, this means that the eyes have been protruded and the person is suffering from proptosis. Once again, you will be doing the extraocular movement test, and you will tell the person to follow your fingers in the direction of the gaze, and you will be telling him to make an H position. Now, you will be doing the pupil examination. This is the most important examination, and there's a phenomenon called the rapid afferent pupillary defect. What happens is this defect is that whenever you shine light on a the pupil generally constructs. However, in this case, the pupil, instead of constructing, it dilates, and there are 5 grades of the RAPD. Now, once again, you will be testing the visual acuity, the visual fields, and using an ophthalmoscope, you will be testing doing the fundus examination. Now, you will be generally palpating the orbit to see if there is any cavernous fistula or if there is any basically visible vascular malformation. Now, you will auscultate the using the back of the stethoscope for any bruit, and you will be following it with thyroid stimulation, the TSA test to detect the level of thyroid hormone function. Thank you. I hope you understand me the majority of the clinical examinations. Thank you.